Hi, my name is Candy Burdan. The research study I selected for this presentation is from Williams et al., Telemedicine Intensive Care Unit Nursing Interventions to Prevent Failure to Rescue. This research study demonstrated and evidenced that telemedicine use in ICU can reduce mortality rate in this clinical setting. The aim of this qualitative research was to find the answer to the question of how do tele-ICU nurses characterize their role in prevention of failure to response in the tele-ICU setting. In addition, the study wanted to discover the function and responsibility of tele-ICU nursing in failure to response and how it influenced patient outcomes. Reasons on why this research is appealing. The research study was conducted in 11 tele-ICU centers in the United States. Emails were sent to the ICU nurses in these centers to obtain participation consent. It was then followed up with an online survey. The survey was employed to determine participant eligibility and gather demographic information of the eligible participants. Eligibility criteria were 6 months employed in tele-ICU for at least 24 hours or more per week in the last 6 months. From 33 tele-ICU nurses who responded to the survey, only 19 nurses consented to be interviewed. The interview questions were standardized to prevent bias. The interviews were conducted via phone, in person, and video conference. These were recorded and transcribed by a third-party organization. The American Association of Critical Care Nurses tele-ICU nursing practice model was used to organize the replies of the participants in the NVivo software. Participants' answers were coded to clinical practice, skilled communication, optimized technologies, and collaborative relationships. According to Williams et al., the research participants stated that a proactive clinical practice suggests that prevention of failure to rescue are by early recognition of clinical manifestations and immediate clinical interventions and treatment. Effective collaboration, relationships, and effective communications are described by rapport and trust between teams. Furthermore, one of the obstacles to failure to rescue is technology itself. Participants stated that they devote more time on the technology and documentation on patient records. Awareness of the ICU nurses' function in providing immediate medical interventions are vital to creating and maintaining relationships. The use of technology improves proactive practice to prevent failure to rescue. The level of evidence of this research is level 3. Using the Joanne Briggs Institute checklist, this research has low quality rating, a small sample size, and research did not include study limitations.